Well, Dr. Carol Cooper, it's great to see you on the programme again. Thanks so much for coming in. I mean, it sounds like a double whammy, doesn't it, that poor Billy's been hit with? What do you make of it?
Well, he's got a lot to cope with, I think, but we're told that the prostate cancer is at an early stage, that it's contained and that it's been successfully treated. And, you know, a lot of men do have prostate cancer. If it's caught early, when it's still within the prostate and if it's not too aggressive, they do very, very well.
What about Parkinson's disease?
That is, I think, more of a long-term problem that he's going to have to deal with. And again, we're told that it's at an early stage, but it involves loss of the brain cells that control balance and movement. And that is really quite a disability for a lot of people, especially if they're active, as he is.
And treatment? What do you think we'll be looking at?
Well, it depends very much on the kind of symptoms, because they do vary a lot from person to person. And you have problems with balance, you also can have problems with pain, with depression, and so on, which actually aren't directly related to movement but occur in Parkinson's. But the main treatment is to replace the brain's level of a chemical called dopamine, which helps with a lot of the symptoms, but doesn't always help with all of them.
Now, we know that he's brilliant at what he does for a living and he cares passionately about his career. He's been going for 48 years. He wants to keep working. Can he, do you think, particularly with Parkinson's?
It really depends how his symptoms are and how well they're controlled and, you know, what he's got. I mean, some people with Parkinson's have memory loss or they have trouble speaking, trouble swallowing. And that kind of symptom would be really hard for a performer.
But Michael J. Fox, I know he was much younger when he was first diagnosed, has actually made it part of his art form, because he's there, we see him now, he's in a sitcom about a man who struggles with Parkinson's disease.
Exactly, and knowing that the talent he's got at his disposal, I'm sure Billy Connolly will manage, but it is a challenge. He will need medication, and it does tend to be progressive, so he may have to change his tack as it progresses.
And good for him for coming forward and talking about
Absolutely.
it and raising awareness.
He's brave to do it, and I'm glad he has, and I'm sure the legions of his fans will be very supportive.
Okay, thank you so much for joining us tonight, Carol.